Hi, my name is Cedric Franken, and I'm a paramedic and the EMS coordinator at the Orange City Area Health System. Our EMS team is made up of paramedics and paid on-call EMTs and drivers. Our critical access hospital allows our EMS team to work closely with our own physicians from picking up patients on 911 calls to transferring them to larger facilities. These same doctors and nurses provide a continuum of care if these patients are admitted to the hospital or sent on to a larger facility. As a paramedic, we have the opportunity to daily use our skills in helping patients in the ER. It also allows us to work face-to-face with our own physicians. Our EMTs are also a valuable part of our team.
Hi, I'm Taylor Malinky, EMT here on the ambulance squad at Orange City Area Health System. I began as a member of this squad about 3 years ago, and that started out as kind of a personal pursuit of just wanting to get experience and a little bit of a resume builder for some other pursuits that I wanted to do later on. And that's since changed, and it's kind of a joy. Just the Lord has me here, and it's a fun opportunity to see the need for this in our community and to just have the skills and maybe the space in my life to be able to serve in that capacity right now. I've seen the difference that Orange City Area Health System makes kind of as an EMT, and just what would this community be without this service and institute. And I've also seen it just as a patient coming here, just feeling very well cared for physically and emotionally by the staff in all areas here, and that's just a fun thing to be part of. I've also have seen many people whose careers are here and they want to stay because they feel the value and they feel appreciated in where they are here at Orange City Area Health System. I often get asked how I balance being on call as an EMT and being a mom of young kids and a stay-at-home mom, and it is worth it when you get here and you see the face that you're called out to help. So the inconvenience of the call changes in nature when you get to see the person. An unanticipated thing I've been able to see is that as a young mom and my kids being there when the pager goes off, they get to see me running out just to help somebody else who's in need or who's in a vulnerable position. And that's a lesson I couldn't teach them or explain to them. They just get to see it in real life, in real time, and they get to learn at 3 and 5 that life is serious, but accidents happen, and just learning what it means as our second greatest call to love your neighbor. And you know, my girls have lifted people up as I'm running out the door, and that patient doesn't know that, but I think that there's immense value in that. The life of EMS is very worthwhile to us, and what I've learned in 3 years doing this.
Hi, my name is Dr. Leland. I am an EMS member here at the Orange City Area Health System. I have been doing this for the past 30 years and enjoy working with the team. When I started 30 years ago, a lot of things have changed from then until now. We started out in a hearse that was remodeled into an ambulance, and we had to work on our knees because we couldn't stand up. And today we have the modern wigs that's behind me, which has been absolutely awesome. Some of the things I've done over the past years which have been interesting and fulfilling is I've delivered 4 babies in my 30 years. I've helped football injuries at the football field, helped people with broken legs. So just a variety of things that I've had the opportunity to work with. One of the reasons that I enjoy serving on this team is just, you know, the camaraderie we have with the rest of the EMTs. We're a group that works together, and in order to make this team work, you have to work together, and it's just been a fulfilling thing to do. One of the things that I've had to deal with over the years is having full-time jobs and then working the ambulance schedule in with that. It is a challenge, but if you are willing to make sacrifices, you can make almost anything work. Since I've retired, the one advantage I have is I'm able to help out more during the day and work on day shifts. Before it was mostly nighttime because I had a full-time job out of town. But it's just given me more opportunity to serve, you know, during the day and help out when I need it.
Hi, I'm Dr. Lee Campstra, Medical Director for Emergency Services at the Orange City Area Health System. Our EMTs and paramedics provide medical care here in the emergency room, as well as pick up patients from accidents and from home to bring to the hospital to provide emergency services. We also transport patients from our hospital to larger facilities so they can get the care they need. Please consider joining our EMS services here to help us provide care for our patients.
Hi, I'm Dr. Alan Laird, Chief Medical Officer at the Orange City Area Health System. I would like to encourage you to consider a career in emergency care. We are always looking for people to join us on our ambulance, whether that is as a driver, as an emergency medical technician, or an advanced provider such as a paramedic. We have a spot for you. This can be a very rewarding career. We feel as doctors and nurses it is critical that we're able to begin care in the field to those patients who need it and to assist us in transferring those patients to higher level of care. As an emergency medicine provider, you are able to provide that care to patients in their time of great need and in the time when they need stabilization the most. Please consider joining us at the Orange City Area Health System on our emergency team to provide the best care to our patients in their time of need.
It's just helping somebody. The thing I've often thought of in Orange City, I don't think people realize what we have here in this town. You have 3 people, 24 hours a day, 7 days a week, 365 days a year that are willing to drop anything they're doing, come answer the call and do whatever they need help with. And that's a great asset for a community. It's just something that I'm just, happy to be part of. It's just a good thing.